Veterans struggling with trauma have relied on traditional treatments, but now some are turning to a controversial approach, psychedelic-assisted therapy. Reporter Stephanie now takes us inside one veteran's experience, as well as the science and laws now catching up.
For many veterans, trauma doesn't fade when the uniform comes off. It follows them home, into their sleep, and into their everyday lives as they struggle to return to civilian life. Many are faced with high rates of anxiety, depression, substance abuse, PTSD, and suicide. Matthew Wiz Buckley, a veteran who started the No Fallen Heroes Foundation after his experience with psychedelics, says conventional treatments weren't enough.
4.5 years ago, after a lot of childhood trauma, military trauma, veteran suicide, losing 4 buddies, F-18 brothers to suicide, I was in a pretty bad place, and I heard about a group of Navy SEALs that go down to Mexico and do psychedelic-assisted therapy. And I figured it can't hurt, right?
Psychedelic-assisted therapy, or PAT, is a process combining psychedelic substances like psilocybin or MDMA with guided psychological support from a professional.
It was one of the most challenging experiences of my life. It wasn't fun. It wasn't recreational. But it saved and changed my life. So I got home from that trip and I said, this is how we're going to end veteran suicide.
Unlike recreational drug use, psychedelic-assisted therapy is highly structured, only suggested by professionals who have exhausted other, more conventional options. Dr. Danny Adams, an assistant professor of social work at the University of Missouri, says there are preparation sessions to ensure the patient is capable and willing. Then comes the actual dosing session, followed by integration sessions, which help patients implement what was experienced during the dosing into their daily lives.
Something we talk about a lot in psychedelic-assisted therapy is set and setting. So ensuring that the participant's mindset is in a good place and that they know what to expect, and also ensuring that the setting is appropriate and is safe.
According to Dr. Adams, because the research is still new, there isn't a definite answer to what causes PAT to feel so healing. The leading hypothesis right now involves something Dr. Adams calls the default mode network, which is the brain's default ability to handle internal thoughts, introspection, emotional processing, and memory.
And what psychedelics do is it quiets that default mode network, and it gives your brain the ability to develop new neural pathways so that you can expand how you might behave or act in a certain situation. You don't just go into default mode. You have the ability to kind of slow down, reassess, and make a new decision.
And Buckley's testimony appears to mirror what early research has found. A study from the Multidisciplinary Association for Psychedelic Studies randomized 90 participants with moderate to severe PTSD into 2 groups, giving one a placebo and the other a dose of MDMA, a synthetic psychoactive drug. Both groups received guided therapy with their dosing.
And what they found is after deploying 3 different dosing sessions of MDMA across 3 different months, and pairing that with preparation and integration for the participants, 2/3 of individuals in the MDMA group no longer met criteria for PTSD.
But access to this option remains controversial and limited. Right now, psychedelic-assisted therapy is largely illegal outside of approved research settings. That could change in Missouri as Missouri House Bill 1717 moves through the legislative process, aimed at expanding research and potential therapeutic uses for veterans. Illinois and Iowa are also attempting incremental approaches to psychedelic policy, from research and advisory panels to limited therapeutic access bills, but both states have yet to legalize therapeutic use. Federal amendments have been made in support of psychedelic use, but progress is slow and mostly focused on research use. Supporters of PAT say it could open doors for veterans with few remaining options and show potential for others who suffer mentally. And critics urge caution, citing the need for more long-term data, the potential of physical health impacts, and ethical ways to implement psychedelics into the medical field. Buckley says he understands why some would be skeptical after the way psychedelics have been portrayed in media and throughout history, but he hopes to be a part of the reshaping of that image.
Radical trauma might need radical healing.
With Tri-State Trusted News, I'm Stephanie Now.